Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A new patient is being evaluated at the request of her primary care provider. While conducting the interview, the psychiatric mental health nurse practitioner has a very difficult time getting direct answers to questions. The patient will try to answer, but often drifts off topic, talking about things that appear related, but she never actually answers the questions. The psychiatric mental health nurse practitioner documents which abnormality of thought process. So this is really rather a straightforward question. It is clearly an assessment question, very specific to the mental status exam, the physical examination of the psychiatric mental health nurse practitioner. So it really is just testing your understanding of the definition of various different types of thought processes. A, B, C, and D are all different types of thought processes. So the patient who tries to answer but often drifts off topic, talking about things that appear related but never actually answering the question. Would this be an example of circumstantiality, tangentiality, perseveration, or flight of ideas? And the correct answer to the question is B, tangentiality. Tangentiality is a thought process that characterizes the conversation in which the person discusses a series of connected topics, but never returns to the original question. And that's the key distinction. Circumstantiality is similar, except that in circumstantial thought processes, the person does typically come back to the question posed. So for example, if you ask the patient, well, tell me, what do you do for a living? What do you do for work? And the patient says, oh, work. You know, I've been working so hard. My first job was when I was 12 years old. I got a paper route, and then as soon as I was old enough, I tried to get jobs in town. You know, some people just don't want to work anymore. This younger generation, it just seems like they don't want to work. But I think work is really important. And I have worked all my life. Even when I was in school, I always worked part-time. And of course, now I work 2 jobs. So now, actually, my full-time job is I work at the automotive service center. You know, I get the people in when they have their appointments, and we get them in and find out what kind of service they want. So right now I work in the service center, but then I actually do Uber Eats delivery at night just to make a little bit of extra money. So yeah, that's what I do now. That would be an example of circumstantiality. That would be the patient who goes off but does come back to answer the question. Conversely, tangentiality is really very much the same thing, but just never comes back to answer your question. What do I do for work? Oh man, I've been working since I was 12 years old. I mean, I've always wanted to work. I've always been a hard worker. You know, even my friends when I was 12 and 13, they didn't want to work so much, but I just always wanted to have a job, always wanted to have my own spending money. But, you know, my parents really just didn't have very much. So if I ever wanted spending money, I had to get it myself. So yeah, you know, I've worked ever since. Even when I went to college, I was always working. And it just seems like, you know, young people nowadays, they don't want to work, do they? I feel like every time I turn around, I'm seeing different things about demands and a short work week and time off. And I just don't know what's wrong with this younger generation. And then it stops right there. And you never got the answer to the question. They went from thing to thing to thing. So that's the difference between tangentiality and circumstantiality. And you should be familiar with the distinction between the two. Now, perseveration and flight of ideas are not in any way consistent with what we're talking about here. Perseveration is characterized by a fixation on an idea or a topic with an inability to move on despite attempts to redirect. For example, the perseverative patient. What do you do for a living? Are you working now? Oh, I do. I work at the automotive service center. I really like dealing with the customers, but you know, this one person I work with, she is just so unkind. She is so nasty, and she just really makes it uncomfortable to be there. It seems like she's never nice to people. She doesn't talk to people. She even gets really unpleasant with me sometimes, and I'm just trying to do my job, you know, but this lady just makes it so hard to be at work. And then you say, well, I'm sorry about that, but tell me about what you do. Tell me about what you enjoy about your job. And you said you have a part-time job. What is that? Well, I know. Yep, I do have a part-time job, and at least everybody there is nice. Thank God, because this woman at my full-time job, I don't know. I mean, I don't know why she's so unpleasant. Some people just are born to be miserable and make everybody else unpleasant. And she does things like she will interrupt me when I'm talking to the clients. And then if clients ask her a question, she acts like they're just really, bothering her. Like, why are they bothering her with this? And I feel sorry for them because the clients look at me like, what did I do wrong? And, I don't know what to say because this lady is just so unpleasant. There's your perseveration. And then finally, flight of ideas is, similar to tangential thought. I mean, these things do have some features that are similar, but in flight of ideas, the ideas just are not clearly as connected. It's really difficult for you to follow what the patient is talking about. So again, to finish with my example here, so what do you do for a living? Tell me about what you do for work. Oh, well, I mean, for work right now, so I just work at the automotive center. It's not really what I wanted to do. Even when I was little, like I really wanted to be in the theater. I know it seems funny now, but I wanted to work in theater. I don't know, like my mother she just like, I don't know. My mother just never gets off my back. I feel like my mother is one of my biggest problems in life. But it would be better, like, if I could just move. Like, I was thinking about getting an apartment so I could be out on my own. Like, even that's probably a little bit too connected for flight of ideas. But this is like the kind of person where you're thinking to yourself, wait, how do we get from here to here? It must have some connection in the patient's head, but I'm not really seeing it. That's more consistent with flight of ideas. And so as you look at this patient and this particular circumstance, it's a very straightforward question. You want to be able to make the distinctions among the types of thought processes. And the example here is B, tangentiality. The patient never returns to the original question. And when you take your boards, you will be asked to identify specific elements of the mental status exam, or maybe even not as simple as identify, but you are expected to be able to know what they are and identify them. And sometimes it gets a little distant, like these things we take so much for granted, and they're on the click and pick menus for assessment, that it's easy to get lost sometimes and think, wow, what exactly is the difference between those two? So as you're studying for your boards, I would definitely spend a little time with that.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.